歡迎大家嚟到今日。
Welcome to the press briefing. On stage, we have Dr. Edward Choi, Controller of Center for Health Protection, Dr. Chang Chok-Kwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Lau Kai-hin, Chief Manager from HA. Dr. Choi, our friends from the media, fellow citizens, good afternoon. As of the 13th of January, we have got 327 Omicron cases, confirmed cases, 295 imported and 32 confirmed local cases. Taking into account highly probable cases, we have got 60 local Omicron cases. These cases have come from two major groups or clusters. So Dr. Zhang may report to you cases arising from these two groups. I will give the floor to Dr. Zhang. Thank you. There were 9 cases tested negative. Case number 13022 to 13030, 8 carrying N501Y variant. And the rest are T478K. And for the remaining one case, the result is pending. 13022 is a construction site worker. His test was negative consecutively upon admission, so we have to observe him for a few more days. He was tested positive, carrying N501Y variant, but T747K, unfortunately, because the viral load was too low, we could not tell whether it was a positive case or an Omicron case. So we will have to keep him under observation for a few more days to see whether he'll be continuously negative, or will he become positive. He lives in Yat Wan House of Tin Yat Estate. He's been working in has been replacing gas pipes at TMHK, and some fellow workers have to be quarantined. As we said yesterday, we have to observe this case. He's got a few workers, or a few healthcare workers have to be put under quarantine. There are 2 cases linked to other cases. The case I referred to was 13022, and I'd like to talk about 13026, a clinic nurse living in JC Place, Taiwan. We talked about this previously. Yesterday, we mentioned another preliminary positive case. The viral load was only 35, 36 when the sample arrived at our laboratory. D616D variant was found. It was a vaccine strain. N0156, etc. were all not tested or negative. So the sample was taken in a clinic. One of the 4 clinics where they worked for at Chilok Garden. And so we went to that clinic and took 21 samples. To see whether it was a vaccine-contaminated case. The samples were sent to Professor Yun at Hong Kong University, and it was reconfirmed that it was a positive case because of vaccine contamination. So this is no longer a case, and we haven't assigned a case number to it. She lives in Block 2 of High-Tech Garden, which was restricted and tested last night. There was unconfirmed or uncertain case this morning. Upon retesting by our laboratory, it was a negative case, so High-Tech Garden doesn't have any confirmed case now. Residents do not have to take the compulsory tests. arising from these two cases. Subsequent tests do not have to be done. And another linked case is a close contact of a confirmed case living in City Garden, Block 3. I mentioned yesterday that the case was sent to a quarantine center on the 5th of January, and now it is a confirmed case. We have less than 10 preliminary positive cases. One is a close contact of phase 3 of Phoenix Garden. There are 2 units affected, and this case is a family member of the unit in the lower story, and the case was sent to the quarantine center on the 8th, and then the case developed fever on the 13th. Now it is a preliminary positive case. Another preliminary positive case is a colleague of a case from Penny's Bay. It's a 51-year-old female who served BOC property services as well, working in Penny's Bay Quarantine Center, a colleague of case number 13004. They ate together, they took lunch together, and their work nature is very similar. We believe the transmission was when they had lunch together when at work, so the case was infected. The case didn't have any direct contact with other confirmed cases. And then I'd like to discuss some earlier confirmed cases. There was a cleaner of a flight cabin, and then a case was 12908. We said that there was CX845 and case 12771. The genetic analysis is 100% the same as 12908. So it's likely that 12908 had to clean the plane, and then the case was infected while doing that. So the case would be classified as an imported linked case, and 12777 arrived to Hong Kong on the 4th of January on CX845 sitting at 46K. 12908 was responsible for that section of the plane. There was another case, 13004. As said previously, the genetic sequencing is identical to that of 12960 at Penny's Bay Quarantine Center. 13001, who lives in phase 3 of Maples Garden. The genetic sequencing is identical with a case 12986. So this is a vertical transmission, so the two cases are linked. That's all from me. Can I invite Dr. Lau to talk about the situation of HA, please? As at 9 a.m. in the past 24 hours, HA has reported 11 cases. In the past 24 hours, another 12 patients have recovered and been discharged. So far, 12,339 patients have recovered and been discharged. As at 9 a.m., 428 COVID patients were being treated at North Lantau Infection Control Center, HA Infection Control Center, and also a World Expo treatment facilities, and also HA hospitals. They are all in stable condition.
I now throw the floor open for questions. Please identify the organization you work for. A lady to the left, near the middle. Ming Pao Daily. I'd like to put a question regarding the case in Yunlong, the food panda delivery man. How many medical or healthcare workers have to be sent to quarantine? When he was sent to the ICU, was he tested before being sent to the ICU? Why is it that you allow a preliminary positive case into the ICU, leading to quarantine of people? Also, the Penny's Bay, another preliminary positive female security guard. Will you be more specific about this female and also the whereabouts? In Twin Boon, there has been a step up in the testing exercise over the past week or so. How many samples have been collected? Some experts are telling us that despite the mass testing, we do not pick up any positive cases. It seems that COVID has eased. Do you subscribe to this idea that the cases in Twin Boon have actually subsided? And also in Nabe Urara, what is the latest? How many positive cases have you detected? Also, there are 14 tables using credit card and 3 using cash in payment. There are 18 tables, including a 20-year-old man. Dr. Chuang, you mentioned 19 yesterday. I defer to Dr. Lau regarding the situation in Yunlong, the patient in Yunlong. The 4 doctors attended to the patient at the A&E ward. The patient took off the face mask, and in A&E ward, the 4 doctors examined him physically, and they have to be subject to quarantine at the moment. Now, the patient was taken to hospital because of traffic accident. He is asymptomatic, afebrile, no fever. At the ICU, he was subject to screening. Basically, all patients admitted to hospital will be subject to screening for COVID. It's at that moment that we detected a positive result for COVID. As to whether this is a re-positive case or whether it is a newly acquired case, we still have to await the laboratory test. All I'm trying to say is that the patient was admitted asymptomatic. He was picked up in the screening exercise, and the 4 doctors examined him, and the patient took off the face mask. And as a result, because of the COVID positive result, the 4 doctors have to be quarantined. I defer to Dr. Chuang regarding Penny's Bay and also Nabe Uwara, and then I take the floor. Penny's Bay. This is a preliminary positive case, female 51-year-old, living in Boarding Garden, Jiangguanhou, Block 4. Last day at work, November 11th. Basically, she delivered supplies, and she was kitted out in PPE, and they would be changing in the changing room, and they would be having meals for 3 times a day. Sometimes they bring their own meals, and they may dine together at Maritime Square with some of the colleagues. And she's been to Jiangguanhou Plaza, Tai Hing, for breakfast, and she may go there for grocery shopping as well. The route of transmission is possibly the result of contact with people. As to Nabe Urara, there are 19 tables, there are positive cases in 2 tables, and there are 17 remaining. There are 4 tables using cash to pay the bill, including the 20-year-old positive case. Cash was used for payment for the rest of them, and they paid by credit card or digitally. We have examined 11 staff members and 10 customers. We are still locating the rest of them. As regards the situation in Tuen Mun, we have conducted a number of days of COVID testing. We haven't picked up any positive cases. We haven't seen any obvious changes, and we cannot confirm any particular changes for the time being. From Dr. Chuang, the number of cases seems to have subsided a little bit, but in the community, in particular in certain areas, we do not rule out any possibility of silent chains of transmission. If you look at Tuen Mun, there are a number of cases who are living in Tuen Mun. When they were carriers, they've been visiting quite a number of places, and the risk of transmission does exist. The other cause for concern is that in the dispensary, the proprietor of the dispensary, we picked up the case from the daughter, and then we identified her father, and we found that the proprietor was infected by a flight attendant. So there has been a two-generation transmission. As to whether there are any chains of transmission, we still have to probe further. Our policy remains that we're going to be issuing the CTNs, and we will be conducting community testing in order to identify possible cases. And with less group gathering, we hope that we can shut down the chain of transmission. The one in the middle on the front row, please. TVB. If I may put a question regarding the Penny's Bay, and her work involves the delivery of supplies and the protective gear. Compared with the previous cases, do you think that she had more in the way of contacts with the positive patients? Like she would be posting the posters, and there is indeed a certain element of risk. And also the Food Panda delivery man, how do you assess the risk of transmission? As a delivery person, maybe during the incubation period, he might got in touch with some other people. And you also said that someone replaced the gas pipes in Tai Po. Are you talking about the gas pipes inside premises or gas pipes outside? Now, if we're talking about the former, maybe the residents there will have to be taken to the quarantine center. Also, the quarantine centers. Do you have any figures about the availability of quarantine center places? Now, there are some quarantined people who complained about the confusing messaging. They don't know when they're going to be tested, and there may be some arguments with the staff, the personnel. Does the Department of Health face any manpower crunches? Do you think that would undermine the effectiveness of COVID prevention measures? Let me say a little bit about the quarantine center, and I'll be deferring to Dr. Chuang about the Penny's Bay and also the delivery man. That the person working in Penny's Bay is actually the same work as some other people. They would be distributing the supplies, and they may be addressing some questions. They may be putting notices outside the doors. Now, she was putting up the notices one time, and the patient opened the screen, the window screen. Speaker not coming through. We don't think so after the questioning, but we'll have to look at the full genome sequencing. There are so many people in Penny's Bay. If we can match up the cases, then it would be a different matter altogether. That the Food Panda personnel, he was working near Kwong Fuk estate, and he was replacing the pipes outside, not so much inside the premises. He delivered for Food Panda, and we're still chasing the information. And normally they would just put the deliveries outside the door, and they will be leaving.
You asked about the number of units available at Penny's Bay. In fact, apart from Penny's Bay with other quarantine facilities, we have 3 designated quarantine hotels, and they're being used, and also the Lei Yu Moon Holiday Camp. We have about 950 units available for use. And depending on the case demand, on a day-to-day basis, we would like to identify more places for quarantine, because if the pandemic situation gets out of control, we need more quarantine facilities. Yes, there have been reports and complaints from members of the public that there were unpleasant experience at Penny's Bay, including delayed testing and delayed departure. And allow me to apologize to all who have been affected. Penny's Bay is just like other quarantine facilities. We have to ensure that all people under quarantine, because they are close contacts, they are only allowed to leave after they are confirmed to be negative. But there are several categories of people that have to go into a quarantine center. First, close contacts of confirmed cases. They have to stay at a quarantine center for 14 to 21 days, and they have to be subject to testing on different dates, and they can only leave after they have completed the multiple tests. And then we have also got household contacts of close contacts. These people are required to stay for 4 days and tested once. The test has to be negative, and they're only allowed to leave after their close contacts are also tested positive. We have to ensure that the household contact is negative, and also his close contact tested negative, and that is the safest. And since the outbreak of Omicron, people returning from very high-risk places have to stay at Penny's Bay for 4 days, where they have to be tested on a daily basis. We have to be sure that they are not infected with Omicron before they're allowed to complete their quarantine at a hotel. Now, the quarantine center involves interdepartmental work. The Department of Health coordinates the operation of the center. And we also operate a health station responsible for medical surveillance, testing, and medical support. Now, if a close contact falls sick, he may become a COVID patient, and he has to be referred to hospital for treatment at once. There are other teams, our medical auxiliary teams responsible for transport of patients, and the civil aid services also responsible for reception, and also sending off of patients, responsible for logistics and also for delivery. Our civil aid services have got a WhatsApp platform to communicate with people under quarantine, and they've also got a hotline. So these departments aside, we've also got the logistics department and SWD responsible for supplies, and EMSDASD for repair and maintenance of our facilities. And our colleagues from FEHD, the police, and FSC are also involved. Our objective is to ensure that people under quarantine would only be allowed to leave if they are negative. Well, we have seen incidents. Most of them took place at around the 6th of January. There were a few large clusters involving a church gathering, where many churchgoers were subject to quarantine, and their household contacts had to be put under quarantine, and there were also a few big clusters. So starting from the 6th of January, we've been receiving a lot of inmates, and then starting from then, we had a large number of complaints, and people complained that tests were done late. So because of, after investigation, we found manual human error in input. People were admitted to a quarantine center, but there was no data input into the system concerned. So staff responsible for testing did not know that they had to test these residents. So that was quite serious, because some people under quarantine may have to undergo 4 tests consecutively, and if they were only known to be present after 2 days, then we had to do all the 4 tests very expeditiously. So we checked all the computer records to see whether there was any oversight or omission, and people required to be tested were given the test as soon as possible to ensure that they could leave after the 4-day quarantine period. So during the few days, colleagues had to identify these cases, and they also sped up the tests. From the 6th to the 13th of January, over 2,150 persons completed their quarantine, and we did over 600 urgent tests, because we hope that they could be allowed to leave in a timely manner. So we found about 60 persons who suffer 1 or 2 day delay compared to their planned date of departure. So for these 260 persons who had to leave our quarantine center later than scheduled, I apologize to them. And after that, we have strengthened our supervision of the whole system to ensure that we would not omit any information at any stage, so as to avoid oversight. Before the fresh wave of outbreak, we added manpower in each team. We had about 600 staff members working. Because of the current wave, we have about 100 staff members working there, because there have been manpower boost in most of the teams. Should there be another spate of people requiring quarantine to the center, we don't want to see a repeat of the incident, so we will be extra careful. English question. This lady on the left.
For the Penny's Bay worker, how would you assess her risk of infection, as she has been to several restaurants? And also, is the current pandemic situation still worrying? How likely do you think the virus can be contained before the Lunar New Year? Thank you.
Could you introduce your organization?
RTHK, thanks.
So I think I'll address the second questions, and I'll let Dr. Zhong to respond to the first one. So at present, although the number of local Omicron case has been steady, or you can see today a little bit reduced, but we don't know whether there's still a silent transmission in some territory in Hong Kong. So we can't say at present the transmission is already contained, but we have to keep monitoring the situation for a certain period of time.
For any confirmed case who has stayed in the community during the infectious period, there's a risk of transmission or spread to other people in the community. That's why we did quite a number of measures, try to reduce the risk, just like to testing all the residents in the same resident building, and quarantine the close contact, as well as compulsory testing of all the places she stayed, especially the restaurants.
下一題，問多條英文問題，隔離嗰位。
Next.
Question from SCMP. So, is there any update on the hotpot restaurant investigation, and how's the genetic sequencing result of the 3 patients? Are they identical? And how was the university student was possibly infected? And second, for the Penny's Bay security guard case, can you clarify how she possibly could have been infected while taking off her PPE? And now that she has spread the virus to a colleague, is there a need to review measures there to prevent future incidents from happening? And third, how's the general condition of Omicron patients, like how many of them are in the ICU. Previous year it was a serious case, and we know that like he should be in stable condition now. Could you like brief us like how generally Omicron patients are? Thank you.
Okay, thanks. So I'll let Dr. Zhang to respond to the hot restaurants case and also the first Penny's Bay case, right?
Mm-hmm. So for the hot pot restaurant, so far we have traced 10 patrons and 11 staff. We are still tracing the other clients who had visited the restaurant during the specified period. And I also appeal to the public that if any of you who had visited the restaurant on that day, please come forward and test. And for the Penny Bay Quarantine Center security guard, we would not ever know how she got infected. This is only our postulation that one of the possible explanation may be if she's, for example, she wore a full personal protective equipment, and somehow if, for example, a confirmed case spilled some aerosol to her, for example, the face shield, when she took off the face shield, if she did not take it off carefully and wash her hands carefully, she may somehow contaminate her eyes or face or nose and got infected. This is a known route of transmission, but we could never confirm. And for the ICU case.
Okay, so Dr. Ma, please.
Now there are 428 patients staying in our HA facilities for the COVID management. None of them are in the categories of serious or critical, and they are all stable. Most of them have no or very mild symptoms of COVID infection, including sore throat, some running nose, or very low-grade fever. And up to this moment, they are all stable. Yeah.
Next question, please. The lady in the front row, please. Cable TV. If I may put a question about the nurse who tested positive, what is the genome sequencing? Was she infected by the son of the dispensary proprietor? Now, what about the doctor who examined this boy, and was he infected? Now, you said that in the there were 180 people seeking medical attention. Have you all identified them? And how was payment made? Was it by cash or was it by digital means? Also, the Food Panda man, it's likely that this is a repositive case. Had this been confirmed? And also, Nabe Urawa, have you managed to track down all the people? Are there any people that have gone missing? Did they all use Leave Home Safe app? Any difficulty there in tracing? Also, the female security guard, maybe she was infected when posting the notices. Have you conducted any genome sequencing? And did you have the results and they're related to previous cases? Or was it part of the silent chain of transmission from Twin 1? I defer to Dr. Chong for the 4 cases. I think we have reported before that the female security guard had the same genome sequencing. Well, for the nurse, this is being done. It might take some time. The doctor is not a case. On the 3rd of May of January, there may have been some misunderstanding about the figures. We cross-checked with the clinic. There were 66, not 180 plus. There may have some gaps in the communication somewhere along the line. They've all been tested. For the Nabe Urawa, we managed to trace the 10 patrons and 11 staff members. We're still continuing with the tracing work because we haven't been able to identify some of them. For those who've been to the restaurant, please get in touch with us. For the genome sequencing, the female security guard in Penny's Bay, it is the same as that of 12960. Now, there are two major clusters. Now, this is part of the 12960 cluster. I think this is a reasonable explanation in terms of the timing. He was negative in the 9th of January. On the 10th of January, he tested positive. Next, please. The second from the back. Now TV. If I may ask about the delivery man, Dr. Chuang said a moment ago that sometimes they just put down the delivery on the floor. What is the situation of human-to-human contacts? Have you managed to identify those who have contacted him? And Nabe Urara, what is the progress so far? Has there been any common use or shared use of the facilities? Right, Nabe Urara, the genome sequencing results have become available, and the 3 patients tested the same. Food Panda, we're still probing because we have to get hold of the list and ask them. Well, I haven't got the information yet. The lady on the left. Oriental Daily. For the 2 nurses, has there been any mutual infection? What is the progress of investigation? Have you managed to get hold of any environmental samples? And how do you assess the risk of the patients being infected? Now, for Nabe Urara, how did the 20-year-old student get infected? Can you rule out the possibility of airborne transmission? Was that an infection by contact? Do you think we have to ban this kind of buffet style establishment? Dr. Chuang? There is only one nurse who got infected. For the other nurse, the sample showed that it was contaminated by, let me put it this way, that the sample was contaminated by the vaccine, not so much contaminated by other people. We have probed the clinic, and it is likely that it was contaminated by the environment because of the vaccines. The clinic became aware of an infected nurse who tested positive, and everyone was arranged to be tested for samples. So for the 30-odd samples, they all tested negative. In the middle of the probe, they got out the vaccine, and we suspect that, the suspected nurse, suspected case involving the nurse, came to collect the sample, and they got out the vaccines in the clinic, and there might have been some environmental contamination that compromised the sample, which tested positive. Now, for Nabe Urara, I think we have to look to see whether there are any other cases. From my colleagues, the EMSD checked the airflow, and they saw that at the first table there was an intake of air, and at the second table there was an outflow. There was the air current coming down. I'm no expert in this regard. I think we have to look at other cases. Airborne transmission, as the expert said, it is a likelihood that this might happen. Next, please. The one in white shirt. In media, 4 questions, if I may. Now, the Whitman Hong birthday party, have you got the latest number of guests? And also Nabe Urara, there are 33 patrons who are close contacts. Other than urging them to get in touch, how else are you going to get in touch with them? Have you managed to identify them? And in Tianbun, do you think that there are still silent chains of transmission? And for the preliminary positive cases, we haven't seen any upsurge. Do you see this as something the COVID easing off?
Let me take your last two questions before I give the floor to Dr. Zhang to address your first two questions. The cases identified so far can be linked to previous cases so far. However, whether there are still other transmission chains in the community, we believe so. We believe there are. The question is whether they can be identified by means of testing. Our purpose is to find other cases by means of testing. And when we have a new case, we will trace the close contacts and their household contacts as soon as possible so that we can identify the next generation of transmission chain as far as possible. It's true that in the past few days we have seen the cases going steady, but there is no ruling out the possibility that there are other transmission chains in the community. It would be premature to say now that the pandemic is under control, so we have to keep it under surveillance. Every day we are seeing new cases. They are still linked to existing clusters. That means transmissions are still happening. It's good to identify the link, but we're worried that if we have an unlinked case and we have to trace the transmission chain or source of transmission. Our assessment is that we can't say the epidemic is easing, but then we will exhaust all our means of tracing and use all social distancing measures. Hopefully, that with the cooperation of the public, we can keep the pandemic under control and we can see an obvious downward trend in terms of the number of cases and even zero local cases. Dr. Zhang. Nabe, Aruma case where we have got information of credit cards and some settled their bills by cash and it's a bit hard to trace them. So if members of the public can recall that they've been to the place, do approach us. Speakers off mic. There were 113 customers there after 9:30 p.m. and they have to be tested. I'm from Hong Kong 01. I'd like to ask about the food panda case. We're told that it could be a repositive case. Have you tested for antibodies? For customers he has delivered food to, do they have to be subject to testing or even quarantine? And case 12872 of goods handler. I'd like to know whether you have traced its link with any case we have. And I'd like to know the number of preliminary positive cases today. Thank you. Dr. Zhang. The case who worked for Food Panda, now he has been vaccinated, so it won't be surprising if he has antibodies, so we have to observe him for a while. We're now tracing his orders and we will try to find out whether he had any contact with customers. Sometimes the delivery man might just leave the food or the order and left it, but some they may chat for a few words. And as for 12872 is still an unlinked source, although the full genome sequencing is identical to the flight attendant case 12672, but we have yet to find out the link. We have less than 10 preliminary positive cases now. Next, over there. Good afternoon, HKET. Regarding the security worker at Penny's Bay, was she responsible for handing out supplies to the people there? And is she the first security guard to be positive there? What is the source? And have you traced the number of people under quarantine she had contact with? Would you have to lengthen the period of quarantine? Now, we have got a confirmed case arising from Penny's Bay, and the case has brought the virus back to the community. So do you think you have to strengthen the personal protection measures for people there? And then you talked about the clinic case. Now, people were subject to mandatory testing, and so some people went to the clinic to give samples. Was it that in the process the nurse touched some vaccine? Because I didn't quite that clearly. And for the negative positive case, we're told that the case is a doctor working in a laboratory. Is it because it was a false positive case because she or he was contaminated with vaccines? And 12838 concealed the fact that she had been to a birthday party and that she had been to Nabe Urawa. I'd like to know the case of the progress and whether there will be any prosecution. We talked about a prosecution, and then Dr. Zhang, we talked about the linked cases. We know that many people work in places that are high risk, and that include quarantine facilities, because people that frequent quarantine facilities may subsequently become positive cases. Another high-risk place is the airport, where people will have to be tested upon arrival. So depending on the level of risk of a place of work, we take great care with the PPE. The putting on and taking off of PPE is a high-risk procedure, and very often infection takes place at that point. And so we will check people working at high-risk places. We'll see whether the putting on and taking off of PPE are up to standard. And as for the transmission among security guards, perhaps Dr. Zhang can brief us on whether there could be human-to-human transmission during their working together or eating together. If we suspect any case that has violated CAP 599D, that is, if they have concealed facts from us or given us false information hindering our investigation, we will consider taking legal action. The cases where prosecution proceedings are underway, but we cannot disclose the details, but the answer is positive. In handing out supplies, yes, the staff may contact people under quarantine, and 13004 had once was once at the door of a confirmed case, and one did not have that situation, but the two ate together in a container, and they sometimes rested there together, and the two are in fact close contacts, and the latter case have been sent to a quarantine center anyway, so it's more likely that the case was infected by the other. And as for taking of samples, a confirmed case who's a nurse, 13026. When the case was preliminarily positive, we contacted the clinic, and one of the doctors asked all medical personnel to go to the clinic at Chilok Garden so that they could be subject to testing. And one of the clinics helped to take samples, and in the process, she took out a vaccine, wanting to inject it. But then, before she did that, she helped to take a sample from another worker. Of course, she had washed her hands before that, and then she took a sample from a preliminary positive case. Perhaps there was contamination in the environment, so that another nurse sample was preliminary positive. So we went to the place to check, to understand the situation. We took some samples. The samples were confirmed by our laboratory and Hong Kong U that the sample was contaminated by vaccine. It was not really an infection case.
You mentioned the person from Hoi Tak Garden during the RTD. The sample wasn't a COVID variant. It was a negative case. Last question. Anyone who hasn't quite asked a question, if not, and supplementary. No, it's not necessary. You're referring to the Penny's Bay people. They all have all the precaution taken. They have the PPE before they see the quarantine leads, so the risk is pretty low. Now for the Whitman Hong birthday party, day before yesterday, you mentioned 222, and now you added 2 who turned up after 9:30. Is it 224? 225. The total is 225. That's it for today. Thank you all very much.